What is triage? Triage is the criteria used to label the patients in a case of a casualty event. It is based on the likelihood of survivability of the patient or the people around. The principle of triage is we need to save as many lives as in little time as possible. So it is just a systematic sorting of patients based on their survivability. There are two types of casualty events, that is a multiple casualty event and a mass casualty event. In a casualty event where multiple people are injured, the number of casualty does not exceeds the facilities available at an institution, whereas in a mass casualty event the quantity of casualties exceeds the resources, like in cases of earthquakes, floods, bomb blasts, or any other casualty involving many like a bus accident or etc. So, triage is a color coding system in which there are four labels, that is red, yellow, green, and black. So, red means there is a need of urgent intervention. So, these cases are cases like airway obstruction, pneumothorax, tension pneumothorax, cardiac arrest, or a cardiac tamponade, or a tracheobronchial injury. In the yellow tag, the patients have severe injuries, but their intervention can wait. That is, cases like fractures, moderate head injuries, which can be stabilized. Green tag is used for ambulatory patients. Those can walk on their own or can move from here to there on their own and have minor injuries like lacerations, abrasions, or bruises. They require first aid and can be managed later on. And black is the label used for patients who are dead or moribund, that is their injuries, they may succumb to the injuries, that is the injuries are too grievous to be healed at that time, and even after life saving procedures there are very few chances that the patient can be saved. So the patient are segregated based on this is called triage. There are special types of triage, that is in case of war conditions. In a case of war or a field event, it is reversed. That is, the patient who are labeled green are treated first so as they can return to their duties, that is, they can resume their duties. Black and red patients are treated after, black patients are segregated, red and yellow are treated after that. Antibiotics classification. So, antibiotics can be classified on the basis of their action, that is what purpose they solve, that is if they based on their mode of action, that is the mode of action of a particular antibiotic, that is if it has a bactericidal action or a bacteriostatic action. For bactericidal action we have penicillin, cephalosporins, aminoglycosides, metronidazole, fluoroquinolones, and for bacteriostatic action we have tetracycline, sulfonamides, erythromycin, clindamycin, for example the macrolides. According to the spectrum of activity, narrow spectrum and broad spectrum. Narrow spectrum for penicillins and aminoglycosides, broad spectrum for tetracycline or chloramphenicol. The mechanism, on the basis of mechanism of action, they can be classified as cell wall inhibitors, or those who affect the cell membrane function, those who inhibit protein synthesis, those who inhibit DNA synthesis, those who affect DNA function, those who inhibit DNA gyrase activity, others are that alter the protein synthesis by misreading the mRNA, and these are the types of classification. Coming forward with aminoglycosides. Aminoglycosides are antibiotics that have names such as streptomycin, parmomycin, neomycin, kanamycin, amikacin. These are the drugs that are used as a parenteral preparation because their gastrointestinal absorption is very poor. So parenteral administration is preferred. Moreover, their single dose is as effective as multiple dose, so a single dose makes it safer, and uh, action is achieved even at a single dose. The prototype drug here is streptomycin. uh, these drugs are used cautiously because they have tendency to cause ototoxicity because they deposit in the perilymph and endolymph. They also tend to cause nephrotoxicity as they deposit in the medulla. These drugs do not cross the blood-brain barrier, so their CNS penetration is very poor. These drugs are used in cases such as tuberculosis as a first line regime as streptomycin, and furthermore in resistant cases we use amikacin, kanamycin for managing bacterial infections. Pneumothorax. Pneumothorax is a condition in which there is air trapping in between the vesicular and parietal pleura. Pneumothorax may be a traumatic pneumothorax or a spontaneous pneumothorax. There can be a tension pneumothorax and open pneumothorax. The management of pneumothorax is basically in an emergency condition. It will be in adults by placing a wide bore IV needle in the mid clavicular line, and in children in the by placing a needle as a needle paracentesis in the mid axillary line. Oh, sorry, in adults at the mid axillary line and children at the mid clavicular line in the fifth intercostal space. Furthermore, after relieving the pressure or draining out the excessive fluid, the definitive management will be placing of a chest tube with all the chest holes inside and covering the wound with a gauze with tape from three sides so as to produce a one way so as to reduce the one way valve and prevent any air entry into the chest wall and just allowing the air to escape. The chest tube is then connected to an underwater seal so as to reduce any backflow of air into the chest on chest expansion. The, the chest tube is inserted in the triangle of safety, which is bound anteriorly by the anterior axillary fold, posteriorly by the posterior axillary fold, inferiorly by the fifth intercostal space, and superiorly by the apex of the axilla. The question is ESR. ESR stands for erythrocyte sedimentation rate. It is a laboratory test which is based on the principle that the fibrin deposition leads to accumulation of or sedimentation of RBCs in a steady state. That is, we use the method of Westergren tube method is used, in which blood blood is allowed to sediment, or the RBCs are allowed to settle at a rate which helps us to differentiate the conditions. That is, if the ESR is raised, we generally tend to think that it is an infectious condition in which the ESR has been raised, and if the ESR falls, then it is correlated clinically likewise. The basic principle behind ESR is the Rolex formation. That is, if there is more fibrin in the blood, that is, the Rolex formation is increased and the sedimentation also increases. It Inferior wall MI. Inferior wall MI in, is most commonly caused by the defect in the RCA and the LCX. The RCA accounts for 80% of inferior wall MI, and the LCX accounts for 18%. Uh, in this condition, the right ventricle of the heart is affected predominantly, so the pumping of blood towards the lung for oxygenation is decreased. In this condition, the body compensates by increasing the preload, that is, increasing the blood supply to the right side of the heart, so as the blood flow to the lungs can be increased. The patient of an inferior wall MI may present with chest pain, pallor, low volume pulse. Bradycardia may be present due to vagal stimulation. Diaphoresis is present. A sick looking patient is generally there. The predisposing factors to an inferior wall MI are age, that is advancing age, history of smoking, history of diabetes mellitus, hyperlipidemic states, that is the patient has been uh, there has been high triglycerides and LDL circulation in the patient. The patient obesity is a condition. Familial inheritance, family history is also an important factor. Then furthermore, the management of an case of inferior wall MI will be the management. Initially, a 12 lead ECG will be ordered, and interpreting the 12 lead ECG, we will move forward with the management simultaneously. That is the management of pain by administering morphine or aspirin, that is 75 to 300 mg of aspirin administered to relieve the pain, and it has shown to decrease the mortality rate. uh, Morphine is used to relieve pain. If the patient is nauseatic and vomiting, we will supplement him with an antiemetic so as to relieve the symptoms. Quick intervention and hospitalization is dependent upon quick assessment of the patient and recognition of the case of an MI. The role of nitroglycerin in such cases is controversial because sublingual nitroglycerin is administered in cases of chest pain and MI at 0.5 mg nitroglycerin or 5 mg isorbide nitrate, which in turn decrease the preload as there is vasodilation due to nitric oxide formation, so the condition worsens. So in these cases, an infusion of nitroglycerin at 0.6 to 1.2 milligram per hour is administered. Furthermore, the management will be reperfusion therapy by either uh, clot dissolving agents like streptokinase or LTPase, or targeted percutaneous thromboembolism. Thrombocyte thrombus is removed by a stenting the patient, that is coronary artery, or definitive management by CABG, that is coronary artery bypass grafting, can be planned. The routine immediate measures which are used in an emergency condition will be administering high flow oxygen, establishing IV lines, and ECG will be ordered, nitroglycerin, analgesics, and opiates for pain relief. And for reperfusion therapy, if we say that percutaneous intervention is preferred because it leads to a definitive management. Thrombolysis has best effects if given within 3 hours to 6 hours, and mortality can be reduced even up to 12 hours window. Hyperthyroidism drugs. Hyperthyroidism is a state in which there is circulation of in which there is circulation of uh, T4 and high levels of T3 and T4 in the blood. So the drugs that are used to decrease this condition or treat thyrotoxicosis are thyroid hormone synthesis inhibitors, that is thioamides, which are propyl thiouracil, carbimazole or methimazole. Then iodine trapping agents like thiocyanate, iodine release inhibitors like iodides or Lugol's iodine, and tissue destroying agents like radioactive iodine. Other agents which help in relieving the symptoms are beta blockers, calcium channel blockers, and steroids. The prototype drug or the thioamides that are mostly used are propyl thiouracil, methimazole, carbimazole. These act by inhibiting the conversion of iodide to iodine and inhibit iodination of tyrosine residues in thyroglobulin. Also, they act by inhibition of coupling of iodotyrosine, that is MIT and DIT, for formation of T3 and T4. There are some adverse effects of these agents, that is they cause agranulocytosis, which occurs after a few months. Hepatotoxicity, nephrotoxicity, fever, pain, rash are other common side effects of these drugs. Iodine trapping agents are used because they have a controversial mode of action, but they are used like Lugol's iodine, iodate sodium, and hypanoic acid. Radioactive iodine is used after administration. It is taken up by the thyroid gland, and it helps in destroying the cells in these by readily uptaking this radioactive thyroid. This is also this radioactive iodine is also used in diagnostic tests, as their uptake can be picked up by other scans. The other drugs which helps in the symptomatic relief, like beta blockers, can help in relieving the symptoms caused due to hyperthyroid states like tremors, tachycardia, palpitations, etc. Propranolol also inhibits the conversion of the peripheral conversion of T4 to T3, so it can be used to control symptoms of thyrotoxic crisis and preoperatively before thyroid surgery.